Hi, my name is Rabiya Hasan, and I'm a child and adolescent psychiatrist at Atrium Health. I've been asked to provide some information on eating disorders. Eating disorders are becoming increasingly common in the United States, and it's important to be aware of signs and symptoms that eating disorders are developing so early intervention can take place. Eating disorders typically do have their onset during adolescence, and they are becoming increasingly common in males and females, and common across different races and ethnicities. So in general, eating disorders are characterized by a persistent disturbance in eating that leads to overall impairment in psychosocial functioning as well as overall impairment in health. So eating disorders can have mental health consequences as well as overall physical health consequences. Another way to think about eating disorders is for an individual to have an unhealthy relationship with their own body image or with food. There are many different types of eating disorders, and for the sake of this brief discussion, we won't discuss all of the different types of eating disorders, but some of the more common eating disorders include anorexia, which is characterized by an intense fear of weight gain, as well as restriction and overall energy intake. Binge eating disorder is actually the most common eating disorder in the United States, and it is characterized by a repeated pattern of eating until one feels uncomfortably full and eating large amounts of food. This is often characterized by guilt and shame, and so individuals do not want to seek out treatment for binge eating disorder. Bulimia is an eating disorder that involves compensatory mechanisms after meals, and so this can include laxative abuse or purging. And an eating disorder that is becoming newly recognized is called muscle dysmorphia. This is actually an eating disorder that's more common in males, and it can be characterized by an obsession with obtaining large amounts of muscle mass. This is thought to be influenced by society's overall obsession with the ideal physique, or even involving more of these superhero films where individuals have what appear to be unobtainable goals and physical characteristics. So there are a lot of different factors that can contribute to the development of an eating disorder. There are, as I mentioned, the overall obsession in U.S. culture with thinness or achievement of these ideal body images. But there's also genetic factors that can have a role in the development of an eating disorder. A family history of an eating disorder increases an individual's risk for developing an eating disorder. There are also some studies that show that individuals with eating disorders have different responses to hunger cues and fullness cues. We don't know if this is a consequence of the eating disorder or leads to the development of the eating disorder, but we are aware that there is a correlation. So it's important to be aware of some of the signs and symptoms that an eating disorder is developing. And disordered eating can occur even if an individual is at a normal weight. Something to look for is rapid weight loss, even if an individual maintains a normal weight, or if there's noticeable fluctuations in weight. Also, if somebody is skipping meals or eating only small amounts of food at different meals. If there's excessive exercise, if there's abuse of any sort of weight-gaining supplements or steroids, and if there's just this overall self-perfectionistic attitude, setting unrealistically high expectations for oneself, and just body image dissatisfaction. If there's teasing or bullying about weight, if there's body shaming, behavioral inflexibility could be another sign. So some of these things are important to be aware of, and if there are any concerns that disordered eating patterns are developing, it's important to seek out treatment. Here at Atrium Health, we work with our community providers to have an interdisciplinary approach to treatment. Treatment typically involves a therapist, a nutritionist, a primary care provider such as a pediatrician, and a psychiatrist. There are no medications that treat the core symptoms of eating disorders, but if there's comorbid depression, anxiety, or other psychiatric disorders that need treatment, a psychiatrist can help treat with medication for those disorders. And there are different levels of treatment depending on the severity of the eating disorder. There can be an outpatient level of treatment. Individuals can have a more intensive outpatient treatment, such as a partial program. There's also residential and inpatient treatment facilities. This is why it's important to have this interdisciplinary approach so we can have a comprehensive treatment plan developed to help the individual and to help be able to challenge the maladaptive thoughts about eating, as well as promoting protective factors, such as being able to have a non-appearance oriented definition of oneself. So this is just a brief discussion of some of the signs and symptoms of eating disorders and some of the options for treatment. Thank you for listening.